In a rural state like Montana, access to doctors can be difficult. Because of that, hospitals in our state have put an emphasis on telemedicine in recent years. I spoke with a Billings doctor who says this technology is making life a whole lot easier for moms-to-be around the state. Ultrasounds. They're an exciting moment for parents-to-be, but they're also critical for assessing the health of the baby.
The heart, we look at all the big vessels that connect up to it, make sure they're connected appropriately.
In a rural state like Montana, access to necessary health care can mean traveling hundreds of miles. But thanks to what Dr. Roger Wallace calls Skype on steroids,
hey Brianna, how are you?
Moms-to-be in less populated areas of the state can have the same access to care as those in our bigger cities without ever having to get on the interstate.
So this gives us the capability of being face-to-face with a patient as if they're here with us. It changes everything in a rural area like this where you're spread out.
From his Billings office, Dr. Wallace is able to watch as Brianna gets an ultrasound at St. James Healthcare in Butte.
And now she's showing me the heart.
He specializes in maternal fetal medicine, and through ultrasound, he's able to pick up on little blips and changes to identify any possible complications or just to give mom the all clear.
You know, all the anatomy we see looks beautiful. I don't see any evidence of any malformations. We didn't before and we didn't today.
Instead of taking photographs from the ultrasound and then sending them off for review, this real-time viewing allows Dr. Wallace to watch the baby throughout the scan, giving a much more comprehensive picture of how baby is doing.
Have you been feeling your baby move and kick a lot since we talked with you last?
Yeah, she's very, very active.
Good. Good.
While the folks at St. James and Butte are equipped to take care of their patients, they don't necessarily have specialists with the kind of experience Dr. Wallace has in-house.
Sometimes there can be subtle indications of significant problems with babies that, because of experience or volume, can be overlooked. And so the general recommendation is if our capabilities are available, that they should be utilized. It just saves you a trip, you know, across the mountains and us a trip in that direction. So we're able to accomplish the same thing we would as if you were here. And hopefully it's a lot more convenient for you that way.
Yeah, absolutely. We greatly appreciate it.